Let's talk about mental health and human rights. Why is it so important that when we think about mental health conditions and the support that we can provide to persons with mental health conditions, we need to talk about human rights, where unfortunately there are many linkages between abuses of human rights and having a mental health condition or require mental health care. These many layers can be found at a community level, where unfortunately we still find many communities where persons with mental health conditions will live a life of being chained or being locked in houses or actually suffer violence on the part of the community. We also find that in services. Across the world, we still have, unfortunately, in many mental health services, an approach that is neglecting and that is not respectful of the rights of persons who are in those institutions. Abuse, violence, medication that is provided without consent are quite common still across the world, the globe. But also outside of the service provision, the communities, the society in general still carries a lot of stigma and discrimination of persons with mental health conditions. So it's a little bit of our responsibility for all of us to change the perception on how we see those who have a mental health condition. Those gross violations, the violence, the neglect that we can see more clearly in some contexts, can also maybe not let us see that there's other violations of rights that are much more subtle. Let's look, for example, into legal capacity. What does it mean that a person with a mental health condition gets removed their legal capacity because, for example, some treatment was given without their consent, and to do that, the legal capacity of that person was considered to be removed. What that means is that that person can now receive treatment without consent, which is something that maybe is not ideal, but it also means much more. It means that that person has lost the legal capacity to own property, to sign a contract, to get married, to even have a bank account. So there's many implications of these decisions that we make on behalf of persons with mental health conditions. The good news is that there's a lot that we can do. So when we look at ourselves and the provisions that we can make of mental health care, we need to make sure that we follow very simple steps. The number one step is that we provide person-centered approaches to mental health care. What does that mean? Well, it means that in all the steps of the care that we provide, from the definition of that care to defining a new project to provide care to people, we're going to have persons with lived experience at the center of what we do. We're going to consult with them, we're going to listen, we're going to hear what is it that they need us to do, and then we're going to define around them. And they are also going to be part of our mechanisms to monitor and evaluate what we do. And they're going to be our advisors along the way of the work that we provide. If we listen, many of the choices that they're going to share is that, for example, peer support is a very important way of caring for each other. And it can be very useful for a person to navigate the circumstances of their mental health condition. Also, having community-based approaches, where instead of looking at institutionalization, which tends to be for long periods, we're looking at services that can be at the community, that can be close to home, but also that the community itself is engaged on taking care of the well-being of the entire community, including those with mental health conditions. We can also look at advanced directives. For example, to avoid this issue around legal capacity, we can work with persons with mental health conditions so they can tell us in advance what is it that they want us to do if there's a crisis that needs to be solved in the future. So there are many tools. We've gone a long way to define how we can work better without having to abuse the rights of those with mental health conditions. We can all do it together, and there are resources there for you to consult. So don't hesitate taking a look at what you're doing, and we all together can provide better services that are human rights based.